I interrupted you, Ms. Hefner, but time is pressing somewhat, and we certainly want to respect the minister's time. And I'm bringing the meeting to order. The motion that was adopted called for two separate panels, one with the minister and one with Dr. Tam and officials. The notice that went out had her here throughout. We're just trying to get contact. I'm not sure if it's technical or what the issue is, but I prefer to begin the meeting now with the minister, and we will, when we've had our hour with the minister, we will reset to a second panel with Dr. Tam. So. Welcome to meeting number 4 of the House of Commons Standing Committee on Access to Information, Privacy and Ethics. Conformément à l'article 108.3.
According to Standing Order 1038H and the motion adopted by the committee on Thursday, January 13th, 2022, the committee commenced its study on collection and use of mobility data by the Government of Canada.
Today's meeting is taking place in a hybrid format pursuant to the House Order of November 25th, 2021. Members are attending in person in the room and remotely using the Zoom application. The proceedings will be made available via the House of Commons website. So you're aware, the webcast will always show the person speaking rather than the entirety of the committee. I'd like to take this opportunity to remind all the participants that that screenshots or taking of photos of your screen is not permitted. Given the ongoing pandemic situation and in light of recommendations from health authorities, as well as the directive of the Board of Internal Economy on October 19, 2021, to remain healthy and safe, all those attending the meeting in person are to maintain a 2-meter physical distance, must wear a non-medical mask when circulating in the room, and it's highly recommended that the mask be worn at all times, including when seated. Although when speaking, I will not wear my mask while speaking. People must maintain proper hand hygiene by using the provided hand sanitizer at the room entrance. As the chair, I'll be enforcing these measures for the duration of the meeting, and I thank members in advance for their cooperation. To ensure an orderly meeting, I would like to outline a few rules to follow. Members and witnesses may speak in the official language of their choice. Interpretation services are available for this meeting. You have the choice at the bottom of your screen of either floor, English, or French. If the interpretation is lost, please inform me immediately, and we will ensure interpretation is properly restored before resuming the proceedings. The raise hand feature at the bottom of the screen can be used at any time if you wish to speak or alert the chair. Members participating in person, proceed as you normally would when the whole committee is meeting in person in the committee room. Keep in mind the Board of Internal Economy's guidelines for mask and health protocols. Before speaking, please wait until I recognize you by name. If you are on the video conference, please click the microphone icon to unmute yourself. Those in the room, your microphone is controlled as normal by the proceedings and verification officer. When speaking, please speak slowly and clearly. When you're not speaking, your mic should be on mute. A reminder that all comments by members and witnesses should be addressed through the chair. With regard to a speaking list, the committee clerk and I will do our best to maintain a consolidated speaking order for members, whether they are participating virtually or in person. So now, I would like to welcome our witnesses. The Honourable...
point of order, Mr. Chair.
Okay.
Sorry.
All right. I saw your hand there, but I wanted to try and get through the introductions and all that. But go ahead, Ms. Khalid.
Sorry, I just wanted to seek some clarification. Are we having 2 panels, or are we having one single panel? I see that all witnesses are here at this time. I'm just trying to sort out the timing piece of it for questioning.
Okay. I don't see Dr. Tam. She is here. Okay. It had been my intention to separate and recalibrate the speaking order at after the first hour, but if the committee would rather we run this all to the end, I can. But that was my intent, was to have our 1 hour and then recalibrate. But
I think that would be a good reset, sir.
Okay, then that's what I will do.
Thank you.
So our witnesses, our witness, we're very happy to have the Honourable Jean-Yves Duclos, Minister of Health, for the first hour. And we have with us from the Public Health Agency of Canada, Dr. Teresa Tam, Chief Public Health Officer. Thank you, Dr. Tam, for appearing today. We also have Kathy Thompson, Executive Vice President, and Christopher Allison, Acting Vice President. So, Minister, you have 5 minutes for your opening statement.
Merci, Monsieur le Président.
Thank you, Mr. Chair. I would like to thank you for inviting me to talk to you today about the Government of Canada's commitment to safeguarding the privacy of Canadians as we work to curb the spread of COVID-19 and protect the health of Canadians.
Officials kindly joining me today include Dr. Teresa Tam, who is Chief Public Health Officer of Canada, Kathy Thompson, Executive Vice President of the Public Health Agency of Canada, and Christopher Allison, Acting Vice President, Corporate Data and Surveillance Branch of the Public Health Agency of Canada. With lives on the line, the Government of Canada has always taken a range of actions to slow the spread of COVID-19, from implementing strict measures at the border, to securing millions of vaccine doses, to providing surge support to provinces and territories. Nous avons pris et nous continuons.
We make well-informed decisions and will continue to do so about policies and programs by reviewing information and analyzing all available data. By basing our decisions on the best available evidence, expert advice, and international best practices, we are able to target our actions to where they are needed most.
Dans le cas de la COVID,
In the case of COVID-19, reliable, timely, and relevant public health data inform our response to the pandemic and thereby protect the health of Canadians.
les données que nous
The data we use comes from many sources, and we are always looking for ways to leverage appropriate data to better improve public health outcomes for Canadians. Use of mobility data is not unique to Canada and to the Public Health Agency of Canada. Governments around the world, including the United States, the UK, Australia, Spain, Germany, Argentina, Brazil, and the Netherlands, to name only a few, are using the data to inform their response efforts to the pandemic. Furthermore, several reputable international organizations have described the social good that mobility data can offer, particularly in response to the pandemic. These include the United Nations, the World Bank, the Centers for Disease Control in the United States, and the European Commission's Joint Research Center. In March 2020, the Public Health Agency of Canada began procuring mobility data to provide outbreak intelligence and inform the pandemic response. In partnership with Innovation, Science and Economic Development's Communication Research Center, the Public Health Agency of Canada has been using de-identified aggregated cell tower location data to support Canada's response to COVID-19.
Ces données
These data was provided through a sole source contract with the TELUS Data for Good program, which expired in October 2021. The Public Health Agency of Canada also entered into a contract with Blue Dot during the pandemic, which will expire on March 18, 2022.
2021, the Public Health Agency of Canada published a request for proposals on buyandsell.gc.ca, which opened a competitive process to continue this work. Je peux assurer tous les membres de ce comité
I can ensure all of the committee that mobility data, which is used and researched, is a precious tool that very much respects the privacy of everyone. Nor do we want to have any delay in acquiring these data because this will have an impact on epidemiological activities currently underway in response to the pandemic. To be clear, the data being sought through this RFP process continues a requirement that it be aggregated, anonymous, and that it protects privacy and does not contain personal data that may be used to identify individuals. No personal information is obtained or provided.
The identified, anonymized, aggregated data is used to monitor the trajectory of the pandemic and how to best respond to it. This information helps governments at all levels determine how the public is responding to public health directives so that we can best tailor our approach and communications. Les données sur la mobilité permettent d'examiner.
Mobility.
Minister, but the motion had called for a maximum 5-minute introduction, and you're about half a minute over, so I could maybe get you to just wrap up in a few seconds if that's possible.
No, I want to respect the time that the committee thought was appropriate, so I'll stop now and turn back to you.
Okay, thank you very much, and so we will begin with 6-minute question rounds, beginning with Mr. Broussard.
Thank you, Mr. Chair. Just before I start, if you could hold off on the time, I just want confirmation that, as is convention around here, that the length of the question is actually the length of the time that it's being answered, correct?
That's the customary practice.
Okay. Why am I hearing feedback?
My earpiece is feeding back, and I don't know how to prevent that. We'll suspend for a quick moment. Feedback seems to have disappeared. I'm not getting any now. Are we all good? No? Okay.
So, yeah.
All right, Mr. Broussard, go ahead for 6 minutes.
Thank you, Mr. Chair, and thank you, Mr. Duclos, for being here today. I want to say right off the top that we're here today not because we don't believe that data is important and evidence-based data is important to manage the pandemic. I think every one of us around the table understand that information is important. The question is, and why we're here today, is because of an RFP that was produced by, as the Minister said, was put out in December, which brought to light a situation that the mobility data of Canadians was being collected, as the Minister said, since March of 2020. Now, let me tell you what this is about, and I'll ask the Minister a question in a second. This is about the fact that it was being done without the knowledge and without the consent of Canadians. That's what's so alarming about this. The other thing is that the Privacy Commissioner, and I know that there's been on a couple of occasions, information that is contrary or contradictory to each other, but the Privacy Commissioner's office said that they had not been contacted about this practice being done. So there are conflicting reports on that. Now, you can speak to anonymized data all you want, aggregated data. There are security and privacy experts, Mr. Chair, who have expressed sincere concern about the security measures and the protocols that were put in place in order to protect the privacy of Canadians. And ensuring their privacy isn't compromised. Now, we are going to hear from experts as we move on further into the study who are going to talk to us about how easy it is to re-identify or de-identify that data for commercial purposes. So my question to the minister is, does he not understand the concern that has come to light as a result of this?
Thank you, Mr. Chair. If I may now answer the question. First, thank you to our colleague, Mr. Brassard, for stating from the start that the use of science and the use of information has been key, not only to save billions of dollars and hundreds of thousands of jobs, but to save tens of thousands of lives. The reason, the outcome of what we've done in the last 20 months, I repeat, using information, data, and science has saved in Canada tens of thousands of lives. In Canada, compared to all other countries in the G7, except for Japan, our death rate is significantly lower. If we had followed the example of our southern border friend, we would have had 60,000 more people dying in Canada. So we can congratulate each other on those actions based on science and data. The second thing we absolutely all agree on, and Mr. Brassard certainly stated that very clearly, is the absolute priority to protect the information of Canadians. And that's why identified, aggregated, anonymized data have used, and 1.7 million Canadians over the last few months have been able to see those data on the web. It's been there since 2020. It was announced by the Prime Minister in March 2020. It was implemented in April 2020. And as of January, 1.7 million Canadians have been able to see those data on the web. So nothing secret, everything transparent, fully science-based, and saving lots of lives.
Mr. Duclos, can I ask why the Privacy Commissioner wasn't consulted on this practice before it started?
The Privacy Commissioner was informed, and there was a conversation right at the start of the pandemic in April 2020. Thereafter,
Informed?
there was a bi-weekly meeting with the Privacy Commissioner twice a month, therefore. Since April 2020, it was determined that the information that was being used was not private, was not confidential, following the regulations and the laws of the government of Canada.
Thank you, sir. The Privacy Commissioner, there is conflicting reports about the Privacy Commissioner's office not being consulted in advance of this information being put out there. In fact, PHAC officials said that they went to security and privacy experts. Who did they use, if not the Privacy Commissioner, for that advice?
The experts, the legal experts of the government of Canada, determined early in the process with the collaboration of various other experts, including comments made and advice provided by the Office of the Privacy Commissioner, that this information was not private and therefore did not engage the Privacy Act. Despite that, bi-weekly meetings were had with the Privacy Commissioner since April 2020 and continued to that day.
But one more question.
Who in Cabinet was aware of the fact that this was going on? Which was the Health Minister involved with this? Did Cabinet make the decision to start this practice?
You, Mr. Brassard, should have known that because it's been posted since April 2020.
Question is, who in Cabinet, was Cabinet aware of this? That's my question.
Mr. Brassard, you don't need to be a member of the Cabinet. The Prime Minister announced that in March 2020. It's been ongoing since April 2020. 1.7 million Canadians were able to visit the application and the website to look at those data.
Thank you, Minister Duclos. And now to Ms. Hefner.
Thank you very much, Mr. Chair. I want to start by thanking the minister and the rest of his team for their service during this pandemic. Truly extraordinary work, and I appreciate it. I have had the opportunity to ask the minister questions in my previous capacity as a journalist, but this is my first time asking questions of a parliamentary committee panel. So I just want to let him know what an honor and a privilege it is to ask about something that's been really concerning me for the past several days, and that is misinformation that is continually repeated, not only online, but in Parliament, Mr. Speaker. And I think when we when misinformation is constantly repeated in places of authority, people get confused. I think maybe even some people of this committee are confused about the facts. So I'd like to show you one example from yesterday's question period, where a member called mobility data a data scoop and went on to say, I quote, "Why was it done in secret without the user's consent? Why wasn't the privacy commissioner consulted?" And so I would just like to ask you, Minister, if you could clarify for Canadians, first off, is this a data scoop? Was it done in secret? Was it done without users' consent? And was the privacy commissioner consulted? I know you've answered a bit of this before, but I think we should, it will do us well to repeat the truth.
Go ahead, Minister.
Well, thank you, Lisa. It's a great fortune to have you as well on the committee. Welcome to the committee opportunities that I'm sure you'll take full advantage of in your new parliamentary career. Three brief reactions. The first one around confusion about the fact. I think we, as members of parliament, we have the duty to avoid confusion and to avoid creating fears when there should be no fear. I've mentioned earlier that those data were and are anonymized, de-identified, aggregated. Anyone who has had a basic training in statistics knows that data that are de-identified, anonymized, and aggregated cannot be used for personal information purposes. You don't need a statistics PhD to understand that. The second thing is that we have worked with the Office of the Privacy Commissioner from the very start, following all the rules and regulations, and we keep working and value very much the work of the Privacy Commissioner. And the third thing is that this has not been secret. It's been announced in March 2020 on the web. Since 2020, 1.7 million Canadians have been able to see those data on an application called COVID Trends. En français, c'est tendance.
It's called COVID Trends in French.
Application, l'application météo.
On the Meteo weather application.
It's been public, it's been announced, it's there. Canadians can look at the data, and we've been using it to protect the health and safety of Canadians.
Go ahead, Ms. Hefner.
Thank you, Minister. And can you clarify for us whether other jurisdictions in Canada or around the world are using mobility data in their fight against COVID-19?
Well, thank you for the question, Lisa, and I hope I have enough time. The United States, the UK, Australia, Spain, Germany, Argentina, Brazil, Colombia, Ecuador, the Netherlands, Italy, Greece, Austria, Bulgaria, Croatia, Denmark, Estonia, Finland, Portugal, Slovenia, Sweden, and Norway, and I'm going to stop here because there are many others. We are all on the same boat, fighting the same disease. We need information and science to beat and fight this disease.
Okay. Ms. Hefner, you got a little less than 2 minutes.
Okay, well then let's talk about what really is concerning to Canadians, and that's that their security of their data and the fact that their privacy be respected. So can you tell us a little bit about how the Public Health Agency protected the privacy of Canadians' data and ensured the security of that data? And maybe even you can talk a little bit about the TELUS Data Privacy Award that was, I think, a recent.
Well, thank you, Lisa. And maybe for a slightly different perspective, maybe I could turn to Ms. Thompson, Katie Thompson, who, as you have heard, is a key expert now with her team now working very hard in an environment in which information and science are key. Katie, if that's fine with you, may I turn to you? And you might want to see whether you want to turn to Mr. Allison also at some point.
Thank you very much, Minister. Good afternoon, Mr. Chair. Yes, I'm happy to speak to the measures that were taken to respect the privacy of Canadians, which was upmost in our minds as we embarked on using mobility data, as the Minister said, at the beginning of the pandemic, and because and in response to the pandemic. So we have ensured that the contract that we had in place with the TELUS and the contract we have in place with Blue Dot, as well as the RFP that you're aware has been posted, puts forward a number of requirements so that we protect the privacy of Canadians. We require that all data that is provided to the agency is de-identified and that it's aggregated. So it's aggregated either temporally or spatially, so in terms of either a period of time, by volume, by geographic region, to ensure that we cannot identify any single individual. All of the information we get is void of any personal information.
We're just about out of time, so thank you for that. Et maintenant, pour 6 minutes.
And now, for 6 minutes, Mr. Villemur.
And you are on mute.
You are on mute.
Excusez-moi, c'est mieux comme c'est mieux.
Apologies. I have a couple questions, but I would like to reiterate that the use of the data was important, but I would also like to know, will you be suspending the cellular data tender as we requested? Answer. Thank you for the question. Thank you for saying that the goal was commendable. We want to protect people during a global crisis, and we have to use all of the tools and all of the information that we have to protect Canadians. We're talking about tens of thousands of people, more people who would have passed away, who would have died if we hadn't used this data. And regarding the tender, I think you can ask my staff and they can give you that information. The tender was supposed to end tomorrow, and it has been moved to February 18th because we were asked for more time in order to submit a better quote, and we wanted to have more competition, which leads to better costs and better results. For the 33 million cellular cell phone users whose data was used, did they consent to that use? There was no surveillance, Mr. Villemur. I said it in English earlier, and I will say it in French now. Data is anonymized, aggregated, de-identified. It is impossible. And we were not requesting private data. You are a well-known statistician, and you understand that aggregate and anonymized data cannot be used to identify people. I am certain that the department cannot identify people. We agree on that. However, inaudible.
You'll have to repeat your question. Your audio cut out for a moment.
I do believe that the Public Health Agency can't identify people, but the data was collected by a third party, and we don't know what they did with that data, and I'm a little concerned. I don't believe that the department can or wants to identify people, but there's also the matter of consent. Inaudible.
Sorry, you're having problems perhaps with your microphone. It's not a question of translation. The audio cut out completely.
Est-ce que ça va ainsi?
Can you hear me now? Apologies. I have a question. The Privacy Act was not infringed upon, but was the spirit of the Act infringed upon? Because I have concerns. Collecting data in this way, does it correspond to the Privacy Act? As you say, the Act wasn't infringed upon, and I'm happy to hear you say it. Perhaps it'll help other committee members understand it. the way that the data was sent to the Government of Canada, well, it was impossible to identify people. This data cannot be re-personalized. It's not possible. So you made clear two facts. And I hope that the committee members heard you. Now, with regards to other perspectives regarding this debate, well, you can work with the committee to see if other experts on other matters of this issue of privacy could be examined. Thank you. But you were at the top of this request. Perhaps the data was nice and clean when you got it, but you have to say something about how the data was obtained. Answer. We have to protect privacy, and there are two conditions to do that. The first is to ensure that our rules are respected, and in this case the Act was respected, and the second condition is to ensure that data that is collected is data that cannot create any risks for privacy. Question. Do you think that people whose data was collected understood what was going on? Answer. There's over 1 million people who were able to see the data used on the weather app and on the COVID Trends app. If you look it up on Google, you can see how the data was used. Over 1 million people were able to see that. Question. But I wonder if they understand the scope of this data collection. Anyway, for my last question, I'm not convinced that there was significant or good enough consent from users. I'm not judging anything. It's not my role, but I'm questioning reasonable consent. Answer. I am certain, and you are a committee that examines ethics and privacy, and you will continue to examine these matters, such as the one for today, and other issues such as the link between the use of information and the sharing of information, because it's more easy now to collect and share data.
Mr. Green, 6 minutes.
Certainly an important discussion, and I want to take a moment by thanking all the witnesses for finding time in their busy schedules to be here. In particular, Dr. Tam, who I understand originally was unable to find the time, but has made the time to be here today. My first question is for Mr. Allison. Mr. Allison, for the purpose of this committee, could you briefly describe your role?
Thank you. I'm very pleased to be here. Mr. Chair, my role right now is the Acting Vice President of the Corporate Data and Security Branch in the Public Health Agency. My normal position is the Chief Data Officer for the Public Health Agency of Canada.
Mr. Allison, is there any other scenarios in which the government has engaged in these types of contracts for the purpose of other evidence-based decision-making, or is this the first time they've done that?
I've been in the agency for approximately 6 months. In this time, this is the first contract that we're going forward with. The agency broadly does have data sharing agreements with provinces, territories, and research institutions, but I'm not privy to the details of all of those agreements, Mr. Chair.
Would you be, through you, Mr. Chair, to Mr. Allison, privy of any pre-existing contracts with third-party private corporations that would be a like-to-like comparison with what's before us today?
Mr. Chair, regarding the mobility data and the question of Mr. Green, there was interest across government and in some of my previous organizations in making use of large-scale mobility data to better understand the population and to better generate policy. The ability to actually do it, though, has come about relatively recently. And in terms of mobility data, the first steps that I've seen come with the COVID pandemic and the desire to actually inform an effective pandemic response.
Through you, Mr. Chair, to Mr. Allison. Mr. Allison, do you know if the Public Health Agency of Canada as a department is sharing this information with other departments for the use of their decision-making and policy?
Mr. Chair, the information, the raw data or the data received from vendors is not shared, but reports and summaries of those reports are shared with provinces, territories, and other organizations for the purposes through which the information was gathered, which is COVID and pandemic response.
Can you anticipate, through you, Mr. Chair, to Mr. Allison, can you anticipate other instances beyond this COVID-19 where this data might be used, or is it your intention, or do you have a policy to destroy the data after it's done?
I'm not certain of a policy. Right now, the contract that we are looking at is for a specific period of time, and the intent would be to use the information for the purposes for which it's collected for that period of time. I believe there are the options for several additional years, and there is research internationally about the use of mobility data to support public health. So I believe there are uses beyond COVID, but the agency has not taken any decision to use it beyond the COVID pandemic at this time.
Beyond the intended use. I can appreciate that. Through you, Mr. Chair, to Dr. Tam. Again, Dr. Tam, thank you for being here before us. I think that, as has been noted by many experts, and in particular, Mr. Christopher Parsons, who's the postdoctoral fellow and managing director of the Telecom Transparency Project at the Citizen Lab in the Monk School of Global Affairs at the University of Toronto. He stated that this is an important opportunity for us to look at the use of data from third parties and, you know, the idea of informed consent. And Mr. Villamore talked about consent. I personally don't believe at the face value that consumers, third party, would have known or had informed consent for this particular use of their data. But through you, Mr. Chair, to Dr. Tam, the repurposing of Canadian cellular networks for things like pandemic mobility travel have provided you with information, and yet we're hearing from the minister and others that it wasn't desegregated, it didn't have demographic information, so it was only able to provide crude assessments of population mobility. So I guess my question is, what is the efficacy of this information in assisting PHAC's public health mandate?
Thank you for that question, Mr. Chair. This is a novel data source, of course, and that one feed into data for looking at the response to the pandemic. So mobility data at this kind of aggregated level can be used to see if provinces and territories or local jurisdiction, when they enact public health measures to reduce contact rates or to ask people to stay at home, for example, whether those are actually working. So you can actually see it at an aggregated health unit level, for example. Ottawa is a city, and the data will show how much percentage increase in mobility there has been in the last period of observation. So that helps the local public health departments figure out if their instructions...
Sorry, Mr. Chair, I have 30 seconds left for you, Dr. Tam. Do you intend to use this information beyond the use of its intended procurement, or do you intend to have a process through which this information will be destroyed?
We're using this for the purpose of the pandemic and looking at the mobility.
And beyond, do you have plans to share with other departments? Like, for instance, when we have a...
You're out of time, Mr. Green, so get real quick. I'll let her have 3 or 4 seconds to reply, and if Dr. Tam, if you'd like, and then we'll move on.
As Mr. Allison has said, the reports are shared with provinces and territories and departments that are making policies.
Okay, thank you. So moving to the next round, which will be, we'll start with Mr. Calkins for 5 minutes.
Thank you, Chair. Minister, thank you for being here today. I would like to know, in order to have useful information or useful data, how many times a day would a Canadian citizen's cell phone need to be pinged in order to be valuable to PHAC?
As I think I said earlier, and as might be useful to repeat again, the data are not individualized. The data are aggregated, de-identified, and anonymized. They have no personal value in role, no personal value usefulness. It has nothing to do with personal information.
I think you're missing the point of my question, Minister. If my phone was pinged at 3 a.m. once a day,
you would find it consistently on my nightstand beside my bed and would be of little to no value in the managing of COVID-19. So my question is, in order for the data to be useful, how many times a day would a Canadian's cell phone location have to be provided to the government in order to make an effective decision? How many times a day? How many data points a day?
As I said, Mr. Chair, the information that we use is not personal information. So I'm sorry, you should ask those questions to someone else, certainly not or someone in PHAC. The information, the data we're using are anonymized, de-identified, and aggregated.
So if you don't know how many times a day a Canadian cell phone is being tracked, how do you know the data is useful? Like I said before, if we're only pinging that phone once a day, how can you be making informed decisions about Canadians' whereabouts or their movements? How many times a day would you need to know where somebody is in order to usefully track people moving around to curb the spread of COVID-19?
That's a better question about the usefulness of the information. I'll quote experts and top world researchers from the U.S. Center for Disease Control and Prevention and from the European Commission Joint Research Center. They say mobility explains transmission and spread and can reduce mortality and mitigate the need for lockdowns. That means, in basic words, saving lives and saving jobs.
You talked a lot about de-identified data. Are you talking about data in its purest form, that you actually have raw data points?
No, Mr. Speaker. Mr. Chair, as I mentioned earlier, the data of which we speak today are data that you can access immediately on your telephone by clicking on the COVID trend. You can also go to the WeatherCan application. 1.7 million Canadians have done that in the recent months. You'll see the data. These are mobility data that we have, and you'll find out why these data are obviously not individualized, not personalized. They are de-identified, aggregated, and anonymized.
So de-identified data is stored in bits and bytes, ones and zeros on a medium. That information, when you delete a file, Minister, and you don't have to have a PhD in computer systems technology or computer science to know this, when you delete a file, all you delete is the link on the file allocation table that references the data on the stored medium. Anybody with any skill whatsoever, anybody under the age of 35 today could probably go back and look at any particular data point on a data medium and re-identify data. It's not a complicated thing to do. So, Minister, what assurances can you have or provide this committee and provide Canadians that their information cannot be re-identified?
We're talking about deletion of a file. Whether the file is deleted or not makes no difference. The fact has no personal information value, no personal information content. That file has no individual level data. It's de-identified, it's anonymized and aggregated. So that file has no value for anyone who would seek personal information.
In your testimony or in your briefing at the start, you mentioned that the information that you have would be useful for other levels of government. Has the Public Health Agency of Canada shared this information with other agencies, provincially or municipalities, or any other actors since you've come into possession of this data?
That's a great question. Thank you for asking it. Ms. Thompson and Mr. Allison and Dr. Tam made a reference to that. Do you want to mention that again, Ms. Thompson?
Yes, certainly. Thank you, Minister. Mr. Chairman, we do provide some report summaries that we share with provinces and territories to help inform their decision-making and their situational awareness with respect to public health and mobility, population mobility. In addition, as the Minister already mentioned, we also prepare summaries of reports that we publish on the COVID trends. That is who we share the information with.
Thank you. And now for 5 minutes, I understand Ms. Sachs.
Yes, thank you. Hear me now? I'm good. Okay, yes, thank you, Mr. Chair, and thank you to my colleagues. I'd like to start by thanking both the Minister and my colleague from the bloc, Mr. Villemure, for making it absolutely clear that the data that PHAC receives through its arrangements with Blue Dot and TELUS cannot be repersonalized. That the deaggregated, anonymized data that is received by the agency cannot identify the Canadians who are moving about their day throughout this pandemic. And I think that's a really important point, and I want to thank the Minister and my colleague for clarifying that to us in the committee room and to Canadians. But I'd like to talk about transparency because that is something that my colleague Mr. Broussard has raised, and you know, there's been some confusion. So the Prime Minister on March 23rd, 2020 announced the Blue Dot contract, and then again on March 26th, Health Canada entered the contract with regards to anonymized deaggregated data. And on April 22nd, 2020, PHAC engaged the Office of the Privacy Commissioner as it moved forward with this useful tool in monitoring the pandemic and the movement of the pandemic throughout our communities. On September 22nd, 2020, the Privacy Management Division issued their analysis confirming that the data from both TELUS Mobility and Blue Dot is not considered personal information and therefore does not engage in the Privacy Act. Furthermore, Canadians were able to engage with Dr. Tam through COVID Tracker to know exactly what was being assessed for the safety and health of Canadians. So at this point, and I can go on into the record of January 25th, 2021, when consultation was held with the Public Health and Ethics Group to assure yet again that the data that was utilized for the health assessments was anonymized and not personalized. So, Minister, you know, since there seems to be some confusion about how we engaged with the Office of the Privacy Commissioner and how the government moved forward in making sure that its contracts received data that was clear of any personalized information, could you maybe go into a little bit deeper the details of the steps and the diligence that was taken by the ministry and by PHAC to ensure that the privacy of Canadians was ensured throughout this process?
Thank you, Ms. Sachs, and thank you, Yara, for that, not only a great question, but the previous great summary of the situation, which I believe will serve to assure and reassure everyone in the committee and anyone else listening and watching us today about the use and the usefulness of those data. On the link to the Privacy Commissioner, the Privacy Commissioner and his office have an incredibly important job to do in the government of Canada. Their advice, their input, their guidance are key to everything we do, including through a pandemic. A crisis is no excuse for not protecting the privacy of Canadians. That's why we've done that since the start, and we'll continue to do that as we keep fighting the virus. As you alluded to, the PHAC was engaged from the very start with the Office of the Privacy Commissioner. Immediately in April, bi-weekly thereafter, there was also a process in the Government of Canada to assess whether the information that was being gathered was subject to the privacy law. A determination was made it was not, and it was not subject to the Privacy Act, and therefore the work continued, again using, as you've mentioned, de-identified and anonymized data, and we'll continue to work with the Office of the Privacy Commissioner as we proceed through the crisis, because as I've said, protecting the privacy of Canadians is an absolute key priority. Whatever we do must fulfill that obligation.
Hey, Ms. Sachs, you've got 30 seconds for question and answer.
At this time, perhaps Ms. Thompson or Mr. Allison can just clarify to me if a multi-barrier security approach was used when PHAC received the data to ensure additional privacy and security measures were in place. Yes or no is fine.
I can answer that, Mr. Chair. Yes. So a multi-barrier security approach was in place to protect and ensure that the data was used appropriately.
Thank you. And now for 2.5 minutes, Monsieur Villemure.
Merci, Monsieur le Président.
Thank you, Chair. Minister, could you indicate to me in detail what was the process where the millions of users consented to this data collection exercise? Thank you, Chair, and thank you, Mr. Villemur. As I've said on several occasions, the Canadian government never collected and will never collect private information. What was asked and what was obtained was aggregated, anonymized information, and so information that could not lead to identifying individuals, nor would there be any sharing of personal information of these individuals. Well, somebody actually was anonymizing the data. The data that we obtained had already been aggregated and anonymized, so it's impossible to then re-identify these individuals. It would be quite impossible and it would be inappropriate. Of course, I agree with you on that. Now, if somebody obtained data that was non-anonymized and anonymized that. So with the first data, how do we actually consent to that initial data? How did your supplier who gave you the anonymized data actually obtain the consent of these millions of users? Mr. Villemur, I think you've understood, but perhaps there's some people who have not yet understood that the data that we requested and obtained is data that's anonymous, aggregated, and de-identified. It's impossible to identify persons, and it's impossible to use the private information about these people on the basis of the data that we used and that is available. 1.7 people have been able to use them over the last few months. Now, the people who anonymized the data for you, did they obtain the consent of the users? I'm saying what we've done within the Canadian government. The data that we obtained, I repeat, is anonymized, aggregated, and it's impossible to lead to any identification of persons or behavior or individual characteristics because these data cannot be used for these purposes. Okay, so was it an ethical action? Well, I think within the context of COVID-19, the Canadian government, of course, absolutely wants to protect people's privacy. The Canadian government has that obligation, that moral and economic and health obligation to protect the health and security of people. There are millions of people who have died, including in Quebec. And unfortunately, they have died, and they may not have died if this work had been done correctly.
Mr. Green.
Thank you. Through you, Mr. Chair, to Mr. Allison. I'm hoping to get a straight answer. I got to say, I'm not comfortable with the way in which I would say language is being used here in terms of who's culpable for this. Because what I feel is what I'm hearing from the minister and from this testimony today is that we're outsourcing potential privacy breaches. So within the context of your procurement contract, through the chair to Mr. Allison, is it the case that Blue Dot and TELUS are always actively engaged in the tracking of mobility of Canadians? Or was this a specific procurement program that would have requested specific data that would have then been aggregated?
Matthew, I'm not sure I understand.
This is to Mr. Allison, Mr. Chair.
Maybe
Mr. Allison.
Well, Mr. Allison may understand better your question, but I'm not sure I understood it.
Point of order.
Okay, we have a point of order.
We're not doing this. I want my time back.
Okay, state your state what is.
Mr. Green to turn his camera on, if that's okay, please, because we can't see him.
That's a fair point of order. If we can have Mr. Green on, go ahead. I stopped your clock, Mr. Green.
Can I please reclaim my time?
Yeah, I'm keeping it track here, and I think you got your question in, and you had. I'll leave it to our panel of witnesses to respond, and then we'll carry on. So go ahead, whomever is going to answer Mr. Green's question.
My apologies, Mr. Chair. Mr. Green, could you please repeat the core of your question, and I would be very.
Well, thank you. The question is this. It's quite simply put. We've heard today that the government's not willing to take responsibility for the collection of this data. You have outsourced potential privacy breaches to Blue Dot or TELUS because they would be the ones who'd be collecting the individual data. So my question through you, when you crafted the procurement for this particular contract, Was it understanding that Blue Dot and TELUS was already collecting this mobility data on people, or did it provide specificity in the request on behalf of the government?
Thank you, Mr. Green. Mr. Chair, both Blue Dot and TELUS collect this data as part of their business. And it may be a point of clarification that in terms of consent, both have options for consent. On TELUS, there's a website where folks can go and look at how their data is being used. It's part of the data for good process. All you need to do is enter your to be that. Blue Dot, as a crowdsourced operator, does this through individual applications on users' cell phone devices.
So then you would agree that in the context of this program, Blue Dot and TELUS were actively engaged in tracking the individual mobility of its users for purposes that the users may not have had full and informed consent on.
I can't speak directly to the business of Blue Dot or TELUS. They do use cellular mobility data, and they do provide that as a service to others. They have both commercial and, again, for good or for social good uses of these programs. And I think that
last question through you, Mr. Chair, is that we've heard time and time again that the Privacy Commissioner had been engaged. The Privacy Commissioner has suggested they had not been consulted, and we heard today that they were not subject to the Privacy Act. So through you to the Minister, if they weren't subject to the Privacy Act, this program, then why the bi-monthly meetings?
Because it's an absolutely essential thing to be able to work together on a continuing, ongoing basis. Obviously, this wasn't the only issue being discussed with the Privacy Commissioner.
Mr. Chair, through you, at any time, did they provide you with a caution?
You're out of time, Mr. Green. I'm sorry. We have the Minister
Mr. Chair,
for...
Can I ask a question? Can the Minister please provide this in writing? The answer in writing, this question?
Okay, fair enough.
Whether or
and
not at any time the Privacy Commissioner provided caution on the program, and if so, what caution?
Okay, your request is noted, and but you're well out of time, and we only have the Minister for about I've got for probably about another 4 minutes. So we're going to finish the round with 2 minutes from Mr. Couric and 2 minutes from Ms. Khalid.
Thank you, Chair. To the Minister, Mr. Chair, 33 million Canadians had their information observed and then aggregated and sent to PHAC. There's a lot of steps in between what PHAC, I'm being told, is received and the information that was collected from the cell phones of Canadians. Minister, were you involved in ensuring that, or was there clear guardrails involved in ensuring that data was protected? Yes or no?
Well, thank you for the question. And first, let me say to Matthew, MP Green.
With respect, Minister, it's with respect, Minister. It's my time. I hope that you can provide that answer in writing to Mr. Green. Were clear guardrails put into place? Yes or no?
Which I will do, and any other questions I will be pleased to answer. And on the guardrails, I've repeated earlier, I'm glad and pleased to repeat that again. The information that we have received is de-identified.
So, Minister, I think you're missing the point. I think you're missing the point. This data does exist. PHAC may not have received it in the report they got, as we got a copy of one of the Blue Dot, but the information does exist somewhere. Was PHAC did PHAC ensure that there were clear guardrails put in place so that the privacy of Canadians was protected at every step of the way from the 33 million users of cell phones across this country, that their data was then aggregated and sent to the department? There's a lot of steps in between somebody's cell phone being observed and the information that was sent to PHAC. Were clear guardrails in place, yes or no?
PHAC did what it had to do, and what other government.
So I'll take that as a no.
Minister,
thank you.
Question,
I think I have enough time.
Point of order, Mr. Chair. The Minister isn't able to answer the question because he's being interrupted.
I've ruled on that already and asked Mr. Couric to stop so that we can get a quick answer from Mr. Duclos. Go ahead, Minister Duclos. Go ahead.
Yeah, I think the time of members of the committee is very important, and it's great to ask great questions. I'm grateful for that, and sometimes I think it's important for members of the committee to hear answers as well. So if I don't have time to answer those questions sufficiently well, please don't hesitate to use other channels to ask them. My team will be extremely pleased to do so. We have a joint responsibility to look after each other, including protecting the privacy of Canadians. And this is what PHAC has done.
Thank you, Minister Duclos. And now for the last 2 minutes to take us roughly to the hour with the Minister. Go ahead, Ms. Khalid.
Thank you very much, Mr. Chair, and thank you, Minister and Dr. Tam and health officials for sharing your time with us today. Minister, we've had this discussion, and I've observed the questions of the members in this issue over the past number of weeks as it's developed. I think what we're talking about is a balance between protecting the privacy of Canadians while also maintaining and using good quality data to protect Canadians' health and safety. So perhaps, Minister, I know that you weren't able to get through a lot of your answers with previous questioners. Can you perhaps outline for us what additional steps did the ministry, did PHAC take to ensure that the safety was protected, that we were able to really secure that balance between security of privacy and security of health for Canadians?
Well, thank you, Ms. Khalid. Thank you, Ikra. That's a great way to frame the responsibility. It's a joint responsibility, as you've said, to protect the privacy of Canadians. It's an utmost absolute priority of this government, and this other responsibility to protect their health and safety. You've said it really well. We have this joint responsibility. That's why the data that were used in a anonymized, aggregated, de-identified manner. And that's why the usefulness of the use of that data has been demonstrated in about 30 countries. I can list them again. No, all G7 countries, most OECD countries that I know of have been using those same data to protect the health and safety of everyone. No, it's a joint responsibility. You've explained it really well, and we'll continue to address that responsibility with your assistance and input.
Thank you very much,
Right.
Minister. And
You're, 2 minutes goes by really quickly. Maybe 5 seconds. If you've got a yes or no question, I'll let it go. But otherwise,
it's not a yes or no question.
Okay. Well, in that case, then we're just about a couple of minutes over on the hour of the minister with the minister. So at this point, I will thank him, and he may if he wishes. Of course, we wouldn't say no if he wanted to stay through to the end. But at this point, we'll thank the minister for appearing. We have Dr. Tam, and we still have our other officials on the call. So I'm going to proceed directly to now back to Mr. Broussard for 6 minutes. Go ahead, Mr. Broussard.
Thank you, Mr. Chair. I want to go back.
I'm so sorry, Mr. Broussard. Mr. Chair, I just had a quick question. Will Dr. Tam be making an opening statement?
I did not receive an indication that there would be an opening statement from Dr. Tam, but I would, and we're much less than an hour now. If Dr. Tam, if you do have an opening statement that you wish to make, I think I would permit it. But if not, I will go directly to questions. Do you have an opening statement, Dr. Tam?
Mr. Chair, no, I do not.
Okay. With that, then, Mr. Broussard, go right ahead.
Thank you, Mr. Chair. Mr. Allison, I want to go back to something that you said. You said that 33 million Canadians who had their mobility data collected had an opportunity to consent by this. And I just want to make this clear, because the 33 million figure is the number of every cell phone that exists in this country. So you're telling me that 33 million Canadians actually consented to having their data collected in the manner in which they did?
Mr. Chair, I actually have no idea where the number of 33 million came from. Through the TELUS contract, there were a maximum of approximately 9 million people who had consented and whose data was used through the TELUS Data for Good platform, and approximately 5 million through the Blue Dot contract. Because the data is de-identified and aggregated, we have no idea to know where the overlap between those two data sets might be. So the actual number is somewhere between 9 and 14 million.
So would those, let's say it's 9 million then, would those 9 million people actually have consented for TELUS to have that information passed on to the Public Health Agency of Canada? Would they have known that that information was going to come to PHAC?
Mr. Chair, those people would have not opted out of the service or of the TELUS option that they had to relate it to the data for good.
So what if they wanted to opt out? What options would have been available to them to opt out to have their data collected for the purposes of PHAC using it? Would they have had that option?
Absolutely. The TELUS website, again, it's a very simple process. You can go in, enter your phone number. It's easily findable under TELUS Privacy Mobility. You enter that, you hit submit, it goes to TELUS, and I'm not sure they have a 24-hour turnaround, but they commit to getting back extremely quickly and making sure that the device is removed.
Thank you. My question is for Dr. Tam. Dr. Tam, I think, as I said at the onset, you can understand the concern of Canadians about having this information collected, I would argue, without their consent. But I'm wondering why this information would be so important when public health agencies across Canada, federally, provincially, municipally, territorially, has access to data that could inform public health response and public health, not just public health response, but public health response going forward. If all of this information is there, why would we put at risk the privacy of Canadians by tracking their mobility data when all of this information already exists? And there are significant risks, and we'll hear about these as we get these security and privacy experts in front of us. But why would you not just use the data that's available to you and other government data that's available to determine public health response both for COVID and in the future as it relates to the RFP?
Yes, just Mr. Chair, I just want to reiterate that this is de-identified and aggregated mobility data. And in the public health context, we look at different types of data and often layer on different information. Why it's, we believe, is an important tool for now and moving forward is that you can use it to layer on epidemiologic data and to determine whether whether, say, there is a outbreak in a certain location. If you can actually, both in real time, but maybe even in modeling and prediction, know how the mobility patterns go in between different areas, whether it's Canada, and indeed mobility data is used in the global context as well to look at the disease spread potential. That can be one way of using this information. And the other application, as has been mentioned, is to help jurisdictions look at the effectiveness of their public health measures. And the identified and aggregated data can certainly help with that. We are in the infancy, I believe, in public health, the application of big data. And we are doing this in a very careful way to respect privacy. But public health, if you look at other reports and lessons learned, you will see that public health lacks a lot of information. And this lack of information is actually laid out quite nicely in some of our external advisory report on the Pan-Canadian data strategy.
Thank you. Quickly, can you tell me why Blue Dot was chosen solely for this contract?
Blue Dot is one of the key groups, companies, and in Canada, in fact, that is already set up prior to the pandemic to collect information. And if there's any further details, I don't actually know that. And Mr. Allison may have the more specific details about the contracts.
In about 10 seconds.
Mr. Chair, I don't have details of why Blue Dot was selected in 2020.
Then we'll go now for 6 minutes to Ms. Sachs.
Thank you, Mr. Chair. Dr. Tam, I want to thank you for joining us today. You've been a voice to Canadians throughout the pandemic of the clear importance that science and data have in guiding us and keeping Canadians healthy and safe throughout the past 2 years. Dr. Tam, in December 2021, the Public Health Officer's annual report actually discussed the value of mobility data to inform the pandemic. So I'd like to ask you, if I may, how important has it been? You just mentioned that there is a deficit of data in the Public Health Agency of Canada. So clearly it seems to me that this process that we've gone through has been vital to protecting Canadian communities. Can you elaborate a little bit?
Yes, thank you for the question. And Mr. Chair, as I said, public health needs more capacity, more tools, and more platforms, including data platforms, to inform our decisions. And I don't mean just for the Public Health Agency. My report points to the whole public health system in Canada. And mobility data is one promising area where I think, as one can appreciate, a virus such as the one that causes COVID-19 is spread from human to human contact and spread via humans moving from one location to another location. So this type of data helps with both the epidemiologic assessments as well as forecasting potential areas of outbreak. And this can be added to our suite of tools, such as wastewater monitoring that we've been trying to expand during this pandemic. So that's why I've highlighted this as one of the data sources that could be very helpful, as well as informing local jurisdictions the effectiveness of some of the measures.
Thank you, Dr. Tam. And just on a follow-up with that, with regards to the current RFP that's being contemplated, what would be the impact if it was delayed beyond its deadline in terms of public health assessments and measures as we move through this fourth wave of Omicron?
Yes, Mr. Chair, so this is a valuable data source, and I think it is most valuable if you have a more continuous ability to look at time. So as we can all appreciate, the dynamics of viral spread and the epidemiology is changing over time, and the policies being enacted in different jurisdictions across Canada, and they can be quite different, is also shifting over time. So having a gap in this data just reduces our ability to look at those important policy measures. But it can be retrospectively looked at as well. It's not as good maybe as more real-time and more prospective analysis. But we're here to try and help the committee and provide the information that you need. And I think the request for proposal has been extended. And we look forward to your deliberations and the outcomes of in your report.
Thank you, Mr. Chair. How much time do I have left?
Plenty.
Plenty. I'm going to share my time with Mr. Fergus, if that's okay.
Yeah, go ahead, Mr. Fergus.
Merci beaucoup, Mr.
Thank you very much, Chair. Generally speaking, I put my questions in French, but as it's a very specific question, I'm going to use the mother tongue. Mr. Allison.
In a response to your question from Mr. Brassard, when we were talking about the consent of TELUS or cellular phone users, can I ask you to phrase it, or perhaps you can help me out here. I think from your answer, what you were trying to say is that there is a consent form that TELUS users would agree to allow their data to be collected, part of their good data, data for good initiative for unspecified, I imagine, range of uses, of which the contract that the government had contracted with that company would fall under the framework of that appropriate use. Is that a fair way of describing it? And if not, could you please clarify?
Thank you, Mr. Fergus. Mr. Chair, the way that the TELUS opt-out works is you do opt out. So you are, I believe, considered by default to have opted in. TELUS does, again, use mobility-related services as part of their business, and I'm not privy to that. You would need to ask the company itself. But the data for good use the disaggregated, de-identified aggregated data to actually understand the movement of populations. And that is the contract that FAC has in place. And a strengthened contract is actually what we're looking at for the new RFP.
Mr. Chair, if I could ask for your obligeance, there was a part of Mr. Allison's testimony that was technically
I'll maybe
didn't appear in
clarify
the
here.
committee room.
I did stop your time,
Thank you,
Greg,
sir.
but I am told that on Zoom and for the members participating by Zoom, jump in if I'm incorrect. But I understand that the audio is okay on Zoom, and the audio is okay for the translators. It is simply our live ability to hear in the
I noticed
room.
that because I'm looking at the screen and I could see him continue to talk, but on the big screen,
the problem is understood. Oh no, the translator is waving to me. So perhaps we have a problem too with translation. I'm going to. I'll suspend and we'll get this sorted out. I understand that we do have, the interpreters also have the same issue we do. Zoom audio is okay, but room audio is a bit of a problem. So I'm not sure at what point.
Was that the point, if I may, Mr. Chair? He started to describe what the good data was, and then I was just waiting for the definition.
All right.
It disappeared from the screen.
Hopefully, since the Zoom audio is okay, we are going to ultimately end up with a good record of this this meeting. But maybe if Mr. Allison can perhaps address that one point and otherwise wrap up his response, because we were running out of time, Mr. Fergus.
I'll make it quick, Mr. Chair. So the Data for Good program is the specific entity or part of TELUS that the contract was with. The original RFP had a number of controls in place to, again, make sure that we were using that de-identified aggregated data, and the new RFP actually looks to take the best practices we had and continue to build on that. Thank you.
Mr. Chair?
Yeah.
Thank you very much for your kindness in allowing me to pose that question. If I just may ask one more thing, if the witness wouldn't mind if he felt that he had more information or wanted to make sure that we had the complete information, if he thought that it was relevant, I would invite him to submit to the committee in writing on this particular question.
By all means, noted. And I will, with that, go to Monsieur Villemeux for 6 minutes.
Merci, Monsieur.
Thank you, Chair. I was very happy to hear from Dr. Tam saying that it wouldn't be an enormous problem if we held up the tender retrospectively. It could be reinterpreted, and the fact that we're pushing out the official date of the tender speaks for itself. Now, Mr. Allison, if I've correctly understood, in TELUS we presume that people have consented because you haven't opted out. So there's presumed consent. Now, this presumed consent, do you think that actually is meaningful consent?
Thank you, Mr. Villemeur. Mr. Chair, the question of meaningful consent isn't really one that I can answer. The TELUS is transparent about what it is doing. The Government of Canada is being transparent about what we're doing, how we're using mobility data. But at the end of the day, it is up to users of the service to actually make the decision whether or not they would withdraw their consent from TELUS.
So if I correctly understand, the average cell user, unless they're more informed and they actively go to the TELUS website, basically they wouldn't know. Is that it?
That's correct.
Okay.
Okay. Now you'll tell me if I'm correct here. So you cannot indicate to me the process whereby millions of users have passively consented to their data being shared. Am I right?
Not exactly, Mr. Chair. So through COVID Trends, which again is a Public Government of Canada website, which has seen more than 1.7 million people go through, there's a very clear link to mobility data. There's a link to the TELUS site. We explain kind of where the data is going from, and we explain that it can be opted out. So.
D'accord. Donc
Okay. So we can withdraw ourselves from this if we are well aware of that. And was TELUS the only supplier of data, because there are other telcos in Canada?
The only telco that was engaged by the Public Health Agency of Canada was TELUS. The current RFP, of course, there may be other bidders or other vendors. And then, of course, there is Blue Dot, which is crowdsourced data, which is different. And that is still active until March 22nd.
Monsieur le Président,
Chairman, I'm being told that the interpretation is not working. Can you confirm if that's the case or not?
I am receiving interpretation. Is there any other? Were there other members that were? I'm receiving information from. Sorry. J'essaie parler français.
I'm trying to speak French to test if the interpretation is working. Are you all hearing me? Is it coming through? Is it coming through in the room? Can I get my time back, please?
My best. I go ahead. Yes, we'll make sure you get your time.
Thank you. So, Mr. Allison, page 21, under 2.3 of the call for tenders in the French version, it talks about usage after the pandemic. So, the usage of location data from a cell phone, will it continue after the pandemic? And who will decide when the pandemic has actually come to an end?
Thank you, Mr. Chair, Mr. Villemeur. I'm not certain exactly who would decide when the pandemic comes to an end. I believe potentially Dr. Tam would be better placed to answer that question than I am. The idea behind the contract is, again, that the mobility data can be very useful as we're looking at a range of public health problems across Canada, and could be useful as we gain more experience both with using the data effectively and using it ethically while protecting the privacy of people in Canada. So the intent is to explore what could be done after that, but without kind of predisposing any decision that FAC might make.
Donc les données pourraient être.
So the data could be used after the pandemic, even if we can't determine when the end of the pandemic will be. Dr. Tam, I'm curious. Will you one day say that the pandemic is over?
So the definition of a pandemic and the declaration, if you like, is done at an international level. At the Canadian level, we could certainly, together with the provinces, look at when we pass what I call the crisis phase of a pandemic. But we believe this virus is going to continue to affect our population for a significant period of time. I'm not the person who was involved in the RFP, but I do believe for example, beyond the COVID situation that we have at the moment. Of course, we should look at what we learn in terms of the application during COVID, because as I said, public health, I believe, is insufficiently capacitated, particularly as it relates to the use of big data. So this is something that we will continue to learn.
Merci beaucoup.
Thank you. So, to summarize, it's possible that the data will be used after the pandemic, even though we don't know when the pandemic will be over. I understand what you're saying, so we don't know for now. Is that correct, Mr. Allison?
Mr. Chair, based off the terms of the contract, which again is public and is open, there is the option to extend the contract.
D'accord.
Okay, thank you. And with that, I'm going to now go to Mr. Green.
I'm really grateful for this opportunity, and I echo again the concerns raised by Mr. Parsons from the Telecom Transparency Project, and that it's kind of opening up an opportunity for the public to just look at how pervasive the collection of mobility data is, and how I would suggest outdated our notions of informed consent and privacy as it relates to protecting consumers. My hope from this committee is that we get to a place where we can get very clear about what that looks like from protecting the individual consumers. Because it still feels, Mr. Chair, and to members of this committee and witnesses, that while I continue to hear this government suggest that they have followed the letter of their law, I'm still unclear about, what the ethics are around the collection of this and what I would suggest to be a surreptitious manner. So through you, Mr. Chair, to Dr. Tam, we've heard yourself and Mr. Allison say you have not been a part of this procurement process. Whom within your agency was responsible for the procurement of this project?
Mr. Chair, maybe I'll turn that over to Mr. Allison.
Thank you, Dr. Mr. Chair, it is my team and I'm responsible for the procurement. My apologies if I had
So the question was put to you earlier on about why these companies were selected. So I'll put that back to you. Why was Blue Dot and TELUS selected as a corporation? And were there other agencies within government who might have been able to provide this information? I think about the budget and the scope of the communications security establishment.
Okay, thank you. Mr. Chair, I'm not aware, again, of what decision was taken in 2020, but the way that the two contracts actually worked together ended up being quite complementary. So we had the level from TELUS, which we found to be more useful, and even then, so we, in fact, did not do the actual data collection or the modeling. This was done on our behalf by ISED's Communication Research Council. They provided us with the reports, and they provided us with the de-identified aggregated data that we could then go back and verify or look if we had any questions on the reports. The data set from Blue Dot is different. It functions and it has different levels, different strengths and weaknesses effectively. So by using both of these two data sets, both of which were in place in 2020, long before I joined the agency, the team was able to better understand the actual population level mobility trends during the pandemic.
So through you to Mr. Allison, as a follow-up, do these contracts allow for vendors to make a profit on the sale of this data that it submits to PHAC beyond the scope of the contract?
Not beyond the scope of the contract, no.
So they can't take this disaggregated data or aggregated data and resell it for other commercial purposes?
Oh, my apologies, Mr. Chair. I misunderstood the first question. The sale of this de-identified aggregated data is part of the business offerings of Blue Dot and part of the business offerings of TELUS Data for Good.
So what would be other examples when they're doing their RFP and showing that they can qualify for the tender? What would be other commercial examples where they would be taking this kind of data and selling it to corporate interests?
Mr. Chair, to be clear, so they would not be selling the data that's provided for us. It is, again, I'm not privy to the inner workings of either TELUS or Blue Dot, so those questions would probably be better posed to them.
Okay, so, through you, Mr. Chair, to Dr. Tam, again, recognizing that there's been a statement of a need for this to be used as evidence-based decision-making. If, in your opinion, through you, Mr. Chair, to Dr. Tam, if in the Chief Medical Officer's opinion, if this contract were to cease, what would be lost in the evidence-based decision-making on a move-forward basis, given this point in our pandemic preparedness and readiness?
Thank you for that question. So, Mr. Chair, as I said, that public health has had a lack of data to inform its decision making. So this is one feed into helping fill in some of those gaps. I do think that insights moving forwards is important because policies are shifting and the spread of the virus is shifting moving forwards. So
supplementary with 1 minute left. Through you, Mr. Chair, could the Chief Medical Health Officer provide one specific policy that would have been drafted and implemented using this mobility data?
I cannot point to a specific policy. This is to be used by the provinces, the partnerships that we have with them to share this information so that they can use it for their own applications.
So, Mr. Chair, in evaluating the reoffering of this contract, surely there would have been some kind of performance measures within the contract that would have shown its efficacy. So through you to Dr. Tam, how would the decision be made, or Mr. Allison, if it's more appropriate, on whether or not the first contract actually met its mandate and its scope?
This will be the last response. Go ahead.
So, Mr. Chair, I will start, but I think Mr. Allison may be the expert in this area. All I can say is that we're at the actual start of the application of this type of information. So if you're looking at an evaluation framework, we would be at sort of developmental stages of these kind of data projects. So as one can appreciate in terms of maturation and evaluation, the indicators that for success are definitely at the sort of initial stages of the setup for this type of data.
Okay, thank you. And we are out of time with that. And so now I'm going to go to Mr. Calkins, and I understand there'll be the time will be shared. But go ahead and start, Mr. Calkins.
Thank you, Chair. Quick question for Mr. Allison. As the Chief Data Officer, you are responsible for the care and control of the data, but you would not just go collect data from any source unless you were directed to do so. Who directed you to go get that information?
Mr. Chair, I was not directed by anyone to go and get this information. The decision to move forward with another RFP was partially due to the first one closing, and because both the data scientists...
Mr. Allison, I'm not talking about the current RFP or the withdrawn RFP. I'm talking about the initial data. Somebody would have directed your organization or your portion of the organization to get the data. I'm just simply asking who it was.
I do not know who may or if anybody did direct the organization to get data in 2020, as I was not here.
Okay, thank you. Dr. Tam, thank you for being here. My question for you, I will follow up on my line of questioning for which the minister evaded. He would not tell me how many data points a day we would need from an average Canadian's cell phone in order to be effective. Mr. Green has asked a question as to whether or not there were any rubrics for the collection of this information to make it useful. So my question for you is, did the Public Health Agency of Canada buy information for which we didn't know any rubrics about how many times a day an individual's phone was pinged and having no actual input into the scientific information gathering process? Am I accurate in that statement?
Mr. Chair, again, I am not the person most intimately involved in this particular initiative. However, I do know that because we've asked for de-identified and aggregated data, we do not get any information on pings at the Public Health Agency. That I just want to clarify that.
Yeah.
But in terms of the methodology and the analytics and the sensitivity and et cetera of the efficacy of the data requirements, I'm going to have to direct that question to Mr. Allison, or we can follow up after this meeting.
I'm going to have to suspend. We think we may have additional audio problems then that may affect the recording of the meeting, so meeting suspended. not certain that our problems can be either properly identified or solved, and time is going by. So I'm going to continue with the meeting. We may have a problem with the evidence being recorded properly for the meeting, which we'll have. I don't think we can resolve immediately, so I'm going to continue. And Mr. Calkins, you have. Sorry. Oh, so Mr. Couric is. You're sharing your time with Mr. Couric, so he has a little under 3 minutes. Go ahead.
Okay, thank you very much, Mr. Chair. To Dr. Tam, thank you for being here. I'm curious about the data itself. You know, we've heard a lot of talk about it being anonymized and de-identified and aggregated, but I'm curious as to the data that I've seen in terms of the Blue Dot report, the information that's available publicly online. Is that what the data looks like when PHAC receives it, or is there more in-depth data that is provided to the Public Health Agency? Could you describe exactly what that data looks like?
Mr. Chair, may I pass this question on to Mr. Allison? I believe the data frame can be provided to this committee if they don't already have it. But it's very aggregated at like a health unit or geographic area. And what I do know is that we're not even looking at numbers, but rather proportions or percentages of shifts in mobility. So maybe could I pass this on to Mr. Allison, please?
Go ahead, Mr. Allison.
Thank you, Mr. Chair. So the data, as said, is de-identified and aggregated, and I understand it doesn't mean a lot in and of itself. The level to which it is de-identified and aggregated, though, is quite significant. So effectively, for one data line, we have a table called percentage of time at primary location. And this basically represents the percentage of time that a cellular device will be at one place. Wherever it spends the most time is the primary location. The data set would say a date, so a single day, would give a province, would give a health region, or potentially down to a census subdivision, which is effectively a municipality. And then we get a percentage of time at that location. So for example, in Manitoba, in a health region, you would have 91%. And we would know that for the aggregate, and that's aggregated time for the day, it's aggregated for an unspecified number of potential users within that health region. We would know that 91% of the time, that device stayed at its primary location, and we would use that as a proxy for movement and adherence with public health measures.
So if I could just dig a little bit deeper into that, you know, the data sources outlined in the information provided to this committee from the parliamentary secretary, it talks about you know, filters to exclude more than 5 unique devices, but it also talks about devices being pinged entering or exiting the country. 2 devices within a household. It gets pretty specific. So forgive me, but the type of data that's actually provided to PHAC versus the massive amount of information that does exist with cell phone providers, there's a massive difference that may exist there, and I think Canadians are concerned about where that line is, and I'm wondering if it would be possible for PHAC to provide some of those specifics so Canadians know exactly what that data looks like.
Please finish, and we'll have a quick response. All right, go ahead then, and we'll have a brief answer, hopefully.
So we have spoken, and I believe we can provide samples of that data to the committee that would help you understand and make your decisions.
Okay, thank you.
Thank you.
And with that, we will go to Mr. Bain.
Thank you, Mr. Chair. And before I begin, I want to thank Dr. Tam for being here, and obviously the minister before her, and thank you for your service and everything you've done during this very, very difficult time. My question is actually probably best directed to Mr. Allison, and forgive me for oversimplifying. I mean, a lot of the technical questions have been been addressed, and we're nearing the end here. But I just want to sort of compare this in a way to say something like, say, Google Maps. If I open up my Google Maps, like probably every Canadian, 38 million of them, when they do it, their phone, they look at it and it shows you where you are. I'm sure every service provider, Rogers, TELUS, whoever you have, Bell, knows the mobility of that dot appears, and it is ultimately apparent where you are and where you're moving to. If we look at that and we compare this information that's coming through, the mobility of Canadians, is it similar to that in some way?
Thank you, Mr. Breen. Mr. Chair, the comparison between the de-identified aggregated data that FACT receives and the amount of data that is being transmitted by mobile devices and used by both applications and telcos is like a bucket compared to the ocean, or a drop compared to the ocean, effectively. And when we're looking at Google Maps, like there are public goods. When I go out, I use it, and I consent to my data being used so that I can understand when I show up at the pool with my kids, where we can get in. So that's one of the social goods that is looked at with this data. The trick really is maintaining privacy and security of folks while we're doing it.
Okay, so and if you, and again, I know that a member before talked about ones and zeros, and it's very easy deleting this and that, and forgive me, I'm not under 35, so I don't know what that all was about. But if you look at like the opting out, and again, I refer back to the Google Maps, and if I can simply, it has those questions on there. Do you want to be this mobility to be followed? And I just say no. And I mean, every application we have on our phone, it asks us, do you want the speaker feature to be to access your phone? Do you want the photo feature to be accessed on your phone? And I imagine, for someone like myself, I don't engage in too many applications, but I still have a lot of them, the calendar feature or so-and-so feature. And now, and I think when you look at all of those things and all of these applications, they all have that opt-out feature. I just want to go back to that and sort of say, is it as simple as that to opt out of this feature? And I'm just relating it to basically what Canadians are engaging in every day. Millions and millions of Canadians are engaging in all these applications on a daily basis. And, what's the difference here, really? And back to you, Mr. Allison, again. Thank you.
Thank you, Mr. Baines. Mr. Chair, I think that's an accurate description. Each of the applications now, because of the changes to operating systems, both Apple and Android do require opt-ins for a large number of the uses, including usually mobility data. Blue Dot also has an internal process in place where they will only provide data to us if a device has appeared over 5 consecutive days. So that also prevents somebody signing in once, ping, and then that making it into the data that's provided or used in the reports.
Okay, and how much time do I have? I think.
Well, Mr. Kirk got an extra minute, so you can have an extra minute too, and you go ahead if you'd like.
Well, actually, I don't have much more than that. I think I do want to maybe mention that I thought it was very clear with the ministers answering the questions in terms of initially what the information is being used for and how critical it is. And it was very clear that it was already publicly available for so long. So I just wanted to thank the minister for clarifying those points. But other than that, I don't have any more. So back to you.
Okay, well,
Mr. Chair.
thank you. And you used most of that, or a good chunk of the extra minutes. So we'll carry on and go to Monsieur Villemeux for 2.5.
Merci, Monsieur.
Thank you, Chair. I'd just like to say to Mr. Baines that the Minister was very, very clear on those particular questions. Now, Mr. Allison, if I've correctly understood, there was some analysis carried out. You need to strike a balance between the public health needs on the one hand, which are quite clear, and on the other hand, protecting privacy. And I'm not going to go into all the fors and against, but a balance was struck between the two. And which criteria led to the choice that was made in striking this balance?
Thank you, Mr. Villemeur. Mr. Chair, I think it's pretty fair to say that the focus of the Public Health Agency of Canada is to protect the health of Canadians, but that can never be done while sacrificing privacy or sacrificing the rights of our citizens. So there is and everything I've seen with my teams and the people putting together the RFP, making sure the privacy of Canadians is an utmost priority is key. Thank you.
Merci beaucoup.
Thank you. That means you've followed the law and you've gone beyond the requirements. But which criteria did you apply and how many criteria were there?
Thank you, Mr. Chair. May I ask a question, a criteria in regards to what?
Oh, je répète.
I repeat. I was saying at the beginning that on the one hand you've got the public health and then you've got protection of privacy and you needed to arbitrate and weigh both sides. So which criteria did you use and how many were there that led to these choices being made in that balancing act?
Okay, I think I understand. Mr. Chair, the law and the Privacy Act for the Government of Canada is very clear. So part of what we did as we were engaging with the Office of the Privacy Commissioner and as our own privacy experts were looking at what we were doing with mobility data and what we wanted to do with the new RFP was first to look and see if there were any privacy impacts or if any personal information was being held or used. And these experts and the external ethics board that guides FAC came to the conclusion that no personal or private information was part of the mobility data that we were looking at. I'd say I don't have a specific list of criteria for Mr. Villemeur, but I'd say in any specific case, we would be going through and part of the work is to make sure that we're doing it ethically and we're protecting and looking after Canadians. Thank you.
And with that, we're just a little over time, so just keeping with the generosity of the last two, we'll go then to Mr. Green, and we'll have Mr. Green for 3 minutes and maybe enough time for a couple of questions from what would be the final round with Mr. Broussard and Ms. Hefner. So go ahead, Mr. Green.
I appreciate your generosity. Through you to Dr. Tam. Dr. Tam had referenced that we are in the beginning of the collection of big data. I would like to know through you, Mr. Chair, to Dr. Tam, for 2022, what would be her thoughts on the ways in which big data will be used within the Public Health Agency of Canada? And are there other aspects of big data collection, of open data that she'll be exploring in her department to make best use of evidence-based decision-making?
I thank the member for the question. And Mr. Chair, I think public health has really not made the best advantage, I think, of available big data. So this is one of the key ones that are being utilized at this point. And, you know, I think that there's other big data sets that could be examined and the application of algorithms and artificial intelligence. But it's quite sad, but true that public health hasn't really made the best use of that. Internationally, I do believe that flight patterns and that type of information is going to be used and it is being used, and other countries are using it to look at the spread of infectious disease. But there are other applications in terms of healthy living and climate change and other
Thank you.
Big data sets that we could probably take more advantage of.
So does it reason then, given the newness of this kind of emerging technology, that perhaps it might be the case that our existing privacy legislation hasn't quite caught up to the technology? When you were taking briefings from the ethics panel, what were some of the cautions that would have been provided to the health agency to ensure that lines weren't crossed, ethical breaches didn't happen?
So, Mr. Chair, I think as Mr. Allison had outlined, one of the, certainly for the public health ethics consultative group, they would have been presented with the facts in front of them, which is that we are using de-identified and aggregated data so that privacy is not an issue. And so I think that there is a need going forwards, and as we have in this case, to state our public health goals. Why do we need this information to help public health response? So that's really important. Transparency, I mean, we have this data posted and explained on the COVID Trends website.
Last question. I'm sorry, that's already
Make it really quick.
Yeah, I got my timer going on here too. Through you to Mr. Allison. Mr. Allison, prior to taking this position, have you ever been involved in a department within the government that has collected this amount of data in such a mass scale?
Mr. Chair, no, I have not.
Thank you. And with that, we're really getting up against our stop time. We're going to go for maybe another. We can have time for maybe 2 minutes each, Mr. Broussard, and followed by Ms. Hefner. Go ahead, Mr. Broussard.
Thank you, Mr. Chair. Through you to Dr. Tam. Dr. Tam, are you familiar with the Flu Watchers program that exists from Public Health Canada?
I'm not directly involved, but of course I know that it exists. Yes.
Okay, so
and that it is a tool for monitoring influenza.
Right.
And I think it's volunteers.
Right. So on the website it says Flu Watchers are Canadian volunteers who normally track influenza, but with global pandemic they're also tracking COVID-19. You can help public officials identify where influenza and COVID-19 may be circulating. Just answer 2 quick questions. It takes about 15 seconds a week. I guess really what I want to point at here is that we have this website that's endorsed by Public Health Canada. It's an opt-in program. People opt in with their consent. Why would we not be promoting this website as a means to determine public health response, the effectiveness, where these patterns are developing, as opposed to running a risk, as is clearly identified, and I think will be identified by security and privacy experts when they come here, including the Privacy Commissioner? Why would we not endorse this website and promote it instead of collecting the data, the mobility data, without consent?
So, Mr. Chair, there are 2 entirely different kinds of data. One is volunteers saying, oh, I have flu-like symptoms. Mobility data gives you the ability to look at spread and the dispersion, if you like, of a virus or and some other infectious disease. So they are complementary, but they are not the same kind of information.
As I go further into this website, Dr. Tam, there are maps that indicate where the spread of influenza and COVID-19 are. Thank you, Mr. Chair.
So, Mr. Chair, yeah, you can say, I have flu and I'm at this spot, but you can't tell the trajectory and the movement that led to the potential spread of that virus. And so they are complementary information and support each other if you were laying on the epidemiologic data.
Thank you. And with that, we'll let Ms. Hefner have the final questions for 2 minutes.
Thank you very much. I'm hoping Mr. Allison can help me with this question, although I know we don't have any cell phone experts on this panel. I do know from covering a lot of criminal trials that cell phone data is often used these days to help solve crimes because it's data that is happening. So when we hear from a member how many phones have to be pinged, it's a little bit misleading because it's not like the government's going out trying to ping phones. Every time you pick up your phone, around you, the companies who run the cell phone towers have that data. The police can ask through the courts to get access to that data to find out where a suspect was at any one time. But it's not like we're going out looking to collect data. This is data that's being collected all the time. Thank you.
Thank you, Ms. Hepburner. And Mr. Chair, I think that's an accurate representation. The cell phone and telco companies collect this data as part of the business and part of the services they provide to users. That is not part of the, or any part of the data or information that is coming to FAC.
And I take Mr. Green's point that maybe we need to look at whether consumers really know that they're consenting to this information being shared, and maybe we do need to look at the privacy laws. But it's not like we're going out looking for data that's not already available. This is data that's available, and people opt into or can opt out of having their data shared.
Mr. Chair, that is correct. And I think as several members of this committee have pointed to, this is a new space for many folks. And there are rapid changes happening. Apple making its changes in April of 2021 to be a more privacy respecting platform. My expectation is that these changes will continue, and I look forward to seeing the results of this committee's report.
All right, and with that, we are out of time for Ms. Hefner, and we are out of time for the committee. So with that, the committee is adjourned.
Thanks, everyone.